Well, PrEP was first rolled out here in South Africa in 2016 as a preventative measure against HIV, currently administered to at-risk HIV-negative groups. But here's the problem, is that only nurses with required credentials can actually administer the medication. A group of medical scientists believe that expanding this will actually ease up a lot of the bottlenecks. So how difficult is it to do that? Here's reporter Hloni Mtimkulu.
While South Africa's response to HIV and AIDS has changed over time, Stats SA still recorded a staggering 8.45 million infected people by last year. To stem this tide, pre-exposure prophylaxis is available to at-risk populations that are HIV negative. But in the public health system, administering this preventative measure is limited to nurses with comprehensive antiretroviral therapy training.
We require at the moment that they have this NIMART training. And, you know, this is quite laborious. And it means that it restricts the numbers of healthcare workers who are able to administer pre-exposure prophylaxis.
South Africa has the distinction of having the highest prevalence of people living with HIV in the world. While the situation has improved since the days of the slow response to available treatment options, those on the ground are calling for the next steps to be taken in South Africa's fight against the virus.
The good news now is on the prevention side, we also have great tools. Besides the condom, which we have had forever, we now can offer things like pre-exposure prophylaxis. So preventing HIV is now within our grasp and something we have to do urgently, particularly amongst young people who haven't necessarily lived through the dark days of when people were dying such a lot of AIDS.
Sibongile Shabalala has been on the roller coaster of the health system's response to HIV since starting on antiretrovirals in 2006. Through her advocacy work, Shabalala is familiar with misconceptions about HIV treatment and prevention.
And when we talk mostly with young people, when we're having our young and youth engagement, they don't know about PrEP. Even those who know about it, they're scared to go and take it because the stigma around it.
Shabalala believes education must accompany the call for an expansion on who administers the preventative measure.
I remember, I think it was 3 months back when our team was monitoring facilities in Northwest. The story that I got shocked me. One of the monitors, when she entered the facility and asked about PrEP, the facility manager didn't know what is PrEP. And if the facility manager doesn't know anything about PrEP, how do you think that facility manager will encourage her staff to provide PrEP?
Specially trained nurses are currently responsible for managing the administration of ARVs, creating a backlog for preventative measures against HIV. Hloni Mtimkulu, Johannesburg.